the big question, for our field is what if we had more accurate prognostic capabilities? And so the way that we're doing it in the lab is trying to investigate those molecular and genetic drivers of JAA disease. So what this means is, when our patients are undergoing, steroid injections into their knees, in the OR or the operating room, we take a very small piece of tissue. It's about the size of a ballpoint pen from this little special tissue that lines the joint. It's called the synovium. And what we do with that then is we try to identify, what cells are present in the synovium and what they're doing by basically looking at what types of molecules or RNA that they're expressing, with the ultimate goal of, being able to personalize treatment so that when we do meet that patient and diagnose a patient, we can pick a medication that's specific for them. I really owe a tremendous amount of gratitude toward, the patients and their families who, agree to work with us. For me, getting to hear from them about how meaningful it is for their own child, but also the possibility of helping children in the future, getting to hear that from patients and their families is kind of one of the most special parts of my job. None of that would be possible without, support from the ANRF. I think, in lots of areas of research, there's, challenges for financial support. And I think one of the unique things too about the ANRF, in addition to providing funds, is really, connecting me with a network of mentors and collaborators that has really advanced my research. When I'm making a new diagnosis of JAA, I think the first and foremost thing that I emphasize to families and, patients is that, with proper treatment and collaboration with their medical team, that, kids will go on to do whatever it is they want to do. They'll achieve all of their life goals. I think that's something that is important to stress kind of first and foremost. I think telling families that, while JAA is part of kind of their medical diagnosis, it's not going to be their identity. They're going to get to be whoever they want to be, and JAA is just part of that journey.